I realize losing one's job, being sort of cut off from society, but what do you think was the most damaging part?
I would say two things, and one is sort of something you can kind of dig into. Inducing panic and hysteria. That is an extremely destructive thing to do. The way to lead humans, I mean, do you think George Patton, induced hysteria in his troops
Right,
when they
right,
were in
right.
trouble? He would go, "Gentlemen, some of you aren't going to make it back. We have an obligation to move forward. Let's go get this thing." That's
Hmm.
how you solve problems. That's how we've always done it, as opposed to shelter in place, hide in your home. Where did
It's
that come
true.
from? I was sure,
Right.
no, there's no infectious disease textbook that advises that anywhere ever. But the whole idea of lockdown came from a 14-year-old girl in Albuquerque. You know that,
What?
right? Oh,
No.
you don't know the history of lockdown?
Was her name
No,
Rochelle Walensky? Was it her?
no,
Was it,
no. Her
was it
name
the
is
young
was
Rochelle?
no. His name was Green. Her last name was Green. So in throughout human history, you quarantine sick people, not well people. Was never a concept of stay in your home or lockdown. Though I will tell you, there's a natural tendency. This is borne out in the smallpox literature that when there's an outbreak, humans tend to reduce their social contact naturally.
Yes,
That's what we
yes,
do when we're
naturally.
trying to protect ourselves. But never, only one time in history was there a stay home order, and that was in Venice. I think it was the 14th century, and it was a catastrophe. Never before. Then we have Wuhan, China outbreak, and we have the government there behaving in the strangest way from a medical perspective. Chlorine containing drugs rolling down the street, squirting the streets. What was that? Locking people in their homes. That's not physicians, I promise, did not do that. No doctors were involved in that decision. That was either something they had rehearsed in case there was an outbreak from their lab, or a face saving measure by the local Soviet, whatever you want
Mm.
to call it, so the higher ups didn't blame them for whatever happened. This was some government action, not medical, not medical. Then we have every press outlet in this country demanding the same response, demanding it. The New York Times editorial board demanding lockdown. That to me was breathtaking and disgusting. I hope people look back at that and look at that with a jaundiced eye and with care, because that was how we got into this mess. And we had a government then responded to it. Then there was even more going on at the time. Of course, anything that was Trump, we had to do the opposite. So Trump says no lockdown, so California locks down completely. Now, I actually signed up for the lockdown at the time and said, well, our leaders are in a tough position. Till we can figure out exactly what we're dealing with, let's listen to our leaders. I mean, that's just sort of my
Bend the
thing.
curve.
Yeah, okay, listen to the leaders. That's fine. But then we're still in it now here in California, for Christ's sake. I mean, it's just
Mm.
unbelievable. So back to the lockdown. This young 14-year-old did a summer science project where she built a model that showed that you could disrupt an influenza outbreak, very different than a respiratory virus, an influenza outbreak by holding kids back from school, essentially. Influenza is hand transmitted and transmitted by kids and kills kids. So it was an interesting model for influenza. Her father, who worked at I forget the name of the lab. It wasn't Los Alamos, but it was another think tank in New Mexico. He was a model builder. He was a computer modeler, and he thought, "Wow, she's really onto something. I bet I can make a model about local lockdowns for a pandemic." The Bush administration found it after he published his paper with his daughter, the 14, I guess now 15-year-old, as the second lead author, as the pandemic policy. That's something that they could do. Now, they never used it. We went through H1N1, which was a terrible pandemic. And by the way, I cut my teeth on the HIV epidemic, which had a 100% fatality, not a
Mm.
1%, not a 5%, a 100% fatality. I was telling people as a third-year medical student every day they were going to die in 6 months. I was never wrong. We never employed this so-called lockdown policy. It was just a theoretical sort of instrument that they put on their sort of, but it was never meant for a respiratory virus and never meant for the entire country. It was meant as
Yeah.
a localized sort of phenomenon, and that
I
became what we lived through. It's just uncanny.
I look around now as people sort of emerge, as they periscope up from in places like New York City, and soon I hope
Mhm.
for you in California,
Mhm.
and you see them coming out more. I mean, maybe a little bit less now with the Delta variant going around and all the scaremongering about it, but in New York, when the masks came off and people started to go back to the restaurants, what I noticed, and Doug noticed it too, my husband, is that there are some people who seem to have gone a little batty. Like there are some people who they've gotten themselves so scared. They've really spent the past year alone,
Yeah.
avoiding restaurants, avoiding
Yeah.
other people, normal people, friends of ours who, are
Yeah.
young and
Yeah.
very cool people. Like it's not like a
Mhm.
bunch of elderly who should be staying at home or no. And you can sort of see there's a little craze in their eye, that you can just see like that. The beard's gotten really long and they're a little unkempt and they look a little scattershot with the eyes. And
Mhm.
I've been just anecdotally wondering what happened to them. What are they coming back from that?
Well, hopefully. I mean, the problem is, I think adults will come back for that. The problem is, may have injured permanently 8 to 15-year-olds who manifest similar stuff.
No.
Humans need social contact. Why do you think the most severe penalties a human can face is isolation? That is the worst that a human can tolerate. Our self emerges in the context of our relationships with other. Our capacity to feel our emotions and regulate them happens because of the reflection of others. Our ability to make meaning of life and have things like careers and be of service is our relationship to others. When that is restricted, as you say, we go batty. It's the worst thing you can do to a human being. And to do it with a particularly no end in sight, it's torture. And this was entered into, but there's another layer to this whole thing that we're getting into here that I want to point out, which is what my profession did. I pointed out to you repeatedly that this was not a medical decision. There's no infectious disease policy that talks about lockdowns and not even social distancing. You won't find that in an infectious disease textbook. But my profession, because of the politicization, because of the mob on social media, because as I've discovered, most physicians now are employees, this was a shock to me. They were afraid of losing their job. They were afraid of their reputation. They were fearful of the mob, and we froze in place. Physicians became unwilling to do anything. I've never experienced an illness where my peers just said, go home till you get sicker. That is the opposite of what we do. Now, interestingly, my surgical colleagues did not do that. They kept improvising and doing things for their family and patients quietly. But trust me, they were doing stuff. I saw it. But the rest of us, the primary care side, froze in place, mostly out of fear of losing the job, I think, or getting attacked by the mob. So we shut up and we ceded our decision-making, our responsibility to the FDA, the CDC, and the NIH. Do you think, Megyn, those organizations ever had anything to do with any decision I ever made when I was taking care of a patient through a 35-year career? Ever? They would send me information and publications and give suggestions. They were not involved in the decision-making. I did that. My training, my judgment. We ceded that entirely to bureaucrats who have not been clinicians in, if ever, many years, who don't understand how to make or can't make a risk-reward analysis from where they are and can't admit they're wrong and can't change direction.
And
it is the worst of medicine.
Know nothing about mental health. Nothing. What are Dr. Fauci's or
reward.
Rochelle Walensky's qualifications there? She's the one, speaking of not inducing a panic, she's the one saying, I feel an impending sense of doom. She's crying.
I have a bad feeling.
Like, grow up.
Thank you. The other thing is we knew how to do health messaging. We studied it during HIV. We had a real problem in HIV. We had to change behavior. And we discovered during that pandemic, was that you create narratives where you see the consequences of people's actions. You use a little music, a little humor, a relatable source. That changes behavior. It's been my model forever in terms of using media. It's why Teen Mom works. It's why Loveline worked, because you have a little case, somebody explicates it, there's some humor, and they hear it, they get it, they receive it, and they adjust their behavior. Somebody in a box and a white coat telling them what to do, or worse yet, in a panic with a bad feeling, that does not change behavior. It hardens behavior. Why do you think we have vaccine resistance? It's all that.